30 pounds, or basically 59 kilograms, that person would need about 1.1 grams of protein per kilogram of body weight each day. Currently, the recommended daily allowance in the United States for protein intake is about 46 grams for the same weighted person each day. So that is a significant difference from 65.7 to 46 grams. And this university is actually located in Padua, Italy, and that's part of that town, that picture. So other studies recommended increased protein intake as well. Campbell recommended an increase above the 0.8 recommended daily allowance each day per kilogram of body weight in order to prevent sarcopenia. Miller and Wolfe suggested increasing physical activity and supplementing protein. And then Miller, Wolfe, and Miller also did another study later that year where they actually gave a number and recommended 1.5 kilograms of protein per kilogram of body weight. So the recommended daily allowance is 0.8. Coyne had told us they recommended 1.1 grams per kilogram of body weight, and now the Millers and Wolfe are saying 1.5 grams of protein per kilogram of body weight. So here Miller and Wolfe also suggest that increasing protein helps avoid muscle breakdown, but this is where I started seeing the vitamins D and B being discussed in the research more often. So they suggest vitamin D and vitamin B supplementation along with iron, zinc, and calcium in order to prevent malnutrition. Van Can and others made these recommendations to include protein supplement, to increase bone density or bone mineral density like Coyne suggested, and muscle mass, eat lots of fruits and veggies in a variety, and also include vitamin D and vitamin B supplementation. So Scherer et al. Looked at vitamin supplementation as well, and they basically looked at how vitamin D related to falls and a higher depression rate, as well as they looked at folate too. Vitamin D is directly correlated with gait, balance, and posture, and they also found that vitamin B levels had really no statistical significance in the amount of falls. So they suggested to increase the vitamin D intake. Vitamin D is the vitamin that helps ward off cancers, combats heart disease, and is an anti-inflammatory. And with the vitamin D deficiency, Levis and others say that osteoporosis and fractures are at higher risk for those, cancer, cardiovascular disease, you have a compromised immune system, diabetes, and just an overall decrease in functionality when you suffer from a vitamin D deficiency. So Levis recommended that the current vitamin D recommendations are too low. Right now, the international units, which is how they sell or market vitamin D and how they're measured, are 400 IUs a day. And adults 71 and over, they recommend 600 a day. However, a lot of studies suggest that 1,000 IUs a day would be optimal. These studies have found that there have been no toxicity or complications whenever they increase the dosage, and other more recent research is even saying that 4,000 to 5,000 IUs a day are helpful whenever a person suffers from a vitamin D deficiency. So Van Dyke and others looked at vitamin B and dementia. Their thoughts were that vitamin D, having low vitamin B, may be a contributor to dementia. So they did vitamin B replacement therapy, And what they found is that the subjects, while they did not find improvement on dementia, they did improve on metabolic and hematologic parameters. Your metabolic parameters are like your glycemic control and potassium levels. So that helped with those. And your hematologic parameters were that they saw an increase in blood cell activity like white blood cell, red blood cell, hemoglobin and platelets. So Mattini and others looked at B12 and B6 and folate and how they relate to frailty. They looked at 703 women between 70 and 79 years old, and they measured frailty through weight, endurance, grip strength, walking speed, and physical activity. And what they found was that a B deficiency causes hyperhomocystinemia. And basically what that means for folks is that they have a higher likelihood of producing blood clots, and in that means that they have a higher risk for stroke and heart disease. So they also found that people with a B deficiency are prone to mitochondrial dysfunction and activation of inflammatory pathways. So Insel, Turner, and Ross in Discovering Nutrition do say that older adults should increase their protein intake. And while they say they should at least get the 0.8 grams per kilogram of body weight each day, they go on to say that older adults should have even more protein than that. They also address vitamin D and B in older adults, and they say specifically that vitamin D status declines in older adults because they don't synthesize vitamin D like they do whenever they're younger, so it's important to supplement with vitamin D. And then they mention vitamin B and B6 and B12 as producing high homocysteine levels whenever there's a deficiency. And that, again, is a risk factor for heart disease. So it's important that people eat fortified foods with these vitamins, but also take supplements so that they can impede these adult onset diseases. So I just want to talk a little bit about MyPyramid. Shelnut, Bobroff, and Deal did a study for the United States Department of Agriculture for the MyPyramid program, and they decided that they needed to expand the MyPyramid to address the needs of older adults. And this is basically what they said. They recommended that older adults drink plenty of water and eat fiber-rich foods, but specifically they suggest that older adults supplement vitamin D and vitamin B through the fortified foods or supplements. And then, again, they go on to tell folks to make sure they eat plenty of protein, fruits, vegetables, and grains. So, in conclusion, Van Cannell tells us that good nutrition helps prevent frailty, muscle loss, osteoporosis, and decreased immune function and cancer, which are all age-related disease. And through supplementation of specific nutrients in older adults, these diseases can be avoided or minimized. And here are references. And this is one of my favorite cartoons because it says, I'm going to order a broiled